Welcome to the Long-Term Care Getting Started Quality Improvement Planning for 2015-16. This is our 7th and final session of going through the Getting Started for Long-Term Care. My name is Patricia Dwyer, and I'm a Quality Improvement Planning Specialist with Health Quality Ontario. And on the line with me is Marg Millward, who's also a Quality Improvement Planning Specialist, and she'll be supporting the webinar today and supporting the demonstration, the Navigator demonstration. And Spears had to leave us because of some weather to try and get home ahead of bad weather. And Linda Volante is the administrative support, and she's also going to be joining us to help with any supports that we need through the session. So how to participate today. So on your right-hand side of your screen, you will see a little box. If you're not seeing it, there's a little red arrow that's like right here that you can press that moves this screen over or moves it back when you press it. If you're hearing me already, you're already connected and on the call. Either you've used your telephone or your microphone to be able to connect. If you're having any difficulty with your audio component of your webinar and you are on your microphone and speakers, you may want to go to using your telephone because it does give a better quality, a better sound quality. You will notice that everyone is on mute, again, to try and protect the integrity of the audio portion for the participants who are on the call. As we move forward, you will see when you click telephone, numbers drop down, and you can certainly dial those numbers to be able to get in. Because everyone is on mute, we will be looking for people to put their questions into the question box. So there are about 40 people on the call, so certainly not enough to be able to open, certainly too many to be able to open up the telephone lines and let everyone have a dialogue. So we do encourage you throughout the session, if you have a question, to pose it. We will be stopping to answer some of the questions and read out some of the questions as we're going through. And we do encourage you to share information or to ask your questions throughout the session. So the learning objectives for this session. So by the end of the session, we hope participants will be able to recall the expectations for the 2015-16 QIPs, understand the role of quality improvement plans as a tool for driving organizational provincial quality improvement, initiate the QIP components, so that Navigator login, access the resources, know where those are, the sector QIPs, the progress report, narrative and work plan, understand the submission process, and describe the suite of supports that are available to organizations. So we're going to look at the overview of quality improvement planning, the overview, just a high-level overview of the priority indicators, components of the quality improvement plan, and we will go through those first as a sort of paper exercise through the presentation, and then we will go back and reinforce those through the Navigator demonstration a little later on. Little run through of the HQO suite of supports, and as I said, questions and answers we certainly welcome throughout the entire presentation. So what is a quality improvement plan? A quality improvement plan is a formal, documented set of quality commitments aligned with system and provincial priorities that a healthcare organization makes to its patients, clients, or residents, staff, and community to improve quality through focused targets and actions. And so we know that there's value of submitting a quality improvement plan. It provides rich information to better understand how we collectively can spearhead improvement efforts. The objectives are similar across all organizations and sectors. So hospitals, primary care, CCAC have been submitting previously, and now with long-term care coming on board, that's four of the major sectors that we're looking at. The quality improvement plan provides an opportunity to share with your peers and to learn with your peers so that we can understand what's working and what's not in making improvements, and to be able to share novel ideas and novel experiences. And it expresses the provincial vision through which priority indicators are able to help us to move the system forward. So we're going to start with a little poll that asks, how familiar are you with quality improvement plans? And Marg, are you ready to launch that poll there for us? not saying. Mark, are you there?
Sorry about that, Trish. Let me just, it's this one, launching. So we're just seeing a number of people that are on the webinar, but they don't appear to be on phone or anything. And so we just want to make sure that they are able to expand their menu by using the little, there's like a red arrow up on the top of this big gray menu on the right hand side, and it will give you, you have an option of phone or mic, and if you click on phone it will give you the phone numbers, and that usually gets you the best sound quality.
Do I need to go back to that page, do you think, Mark? No, it says found it, thank you.
I see one person's found it. There's a couple of other people still not on. If you are having trouble getting on, well, they probably can't even hear us. Maybe we'll chat something on to them.
I'm just going to go back a little bit so that they can probably see where this one. Oh, except, of course, I need to go back further.
Okay, and I've got the poll up so people can't see it. So we're going to just close. Oh, no, we're not going to close the poll because we need a few more people to chime in. And we'll close the poll and just go through the how do you get onto the phone, because that's either the phone or the mic, so that you can hear the conversation. Okay, it's good. Some people are able to hear just from their computer. It shows you the people who are listening in their computer as having your mic, but we're seeing some people with no sound. Anyway.
I think there's one or two people there, Mark, that, oh no, there's a number of people.
Yeah. Okay, so I'm going to post up this poll, and then we'll just go back to the how to get into the sound. So we're closing this poll and posting it. So there's only 22%. There's about 50 people on this webinar. So 22% who are very familiar. We have 69% who are somewhat. They've been involved before, and 8% that are newbies.
Okay, good.
I'll just hide that away, and then you can show the phone.
So you want me to go back to the phone page? I'm just going to end the show and go back to that slide so that I'm not making people dizzy.
Alrighty, and I'll try to type in so that they can just view the.
Okay, so I'm just going to click through, and I apologize to you, those of you who have already been through it, but hopefully those who are on their computers can see it and will be able to move through it. They're actually seeing the. Well, Linda, are you actually able to see if people are able to get on now?
Can you hear us typing away? Trying
to get the information out there.
Well, there's only 4 people.
I'm going to go back to where we were so that I'm not holding everybody up here.
Yes, that'd be great. Go just after that poll.
Yep. So just getting back here to get everything back up and change my settings up here. Oh, sorry everyone. Of course, when you're trying to do something, it flows on through on its own. So now we're going to have to go back a few slides. There we go. Okay.
That looks good, Trish.
Yep, so we're back to where we needed to be. So this slide is really just giving you some of the background of quality improvement plans. So even though we had last year was optional or volunteer for long-term care homes to be able to submit their quality improvement plans. We're certainly looking at that this is really the implementation year for quality improvement plans, and we know there are various phases for quality improvement plans. So the first year, your implementation year, the goal is not perfection. We recognize that this is really getting started. It's putting a stake in the ground and facilitating a common vision for the advancement of quality in the organization. And every organization will have the flexibility to develop QIPs to meet their individual community needs by creating and adding new indicators, while the QIP template provides a common provincial vision by having predefined priority indicators. And I think this is a good place to really confirm that people do understand there's a difference in mandated and priority indicators. Priority indicators are not mandated. They are just what they are, priority indicators at the system level. And while many of them will be priorities for the long-term care homes, not all of them may be a priority for you. So we really do want you to be able to look at the areas where you wish to improve, where you do have metrics, to be able to look at those numbers. And if you're doing very well, I'll just pick on one. So let's say you're doing very well with falls. You may not want to be able to, you may not want to focus on that in your quality improvement plan, but there may be something else within your home, such as your immunization rates, that you really want to focus on your immunization rates with staff and within your long-term care home residents. And maybe that's a priority for you. So you would add that in as a new indicator, and you're certainly welcome to work on the new indicators. As we move forward and as the years with quality improvement plans progress, we know that the second year starts to look at some standardization. So using the common indicators, common language, common resource periods, all those types of things. And then the third year, we're starting to see benchmarks and targets appearing. And then in the fourth year, we get some accountability. Accountability, in this sense of the word, is talking about accountability within your organization for moving on your targets and really looking at what it is that you need to be focusing on. As years progress, we know that some indicators will be retired as the system does move to make improvements, and then other indicators may be added. And as we add other indicators or new indicators, we may find that we will start with that implementation and follow all of the processes again through the standardization, understanding and developing benchmarks, and then you reach that point where you know you're comfortable with where you are, and within your organization you're accountable for the metrics that you achieve and the process of where you want to be going in the direction that you're headed. This is not talking about accountability as in pay for performance or anything like that. This is totally different definition of accountability. So the Health Quality Ontario approach to quality improvement plan, we certainly look at, you can see all these bubbles on the left, so identify and plan for the QI opportunities, catalyze quality improvement, build capacity and knowledge, and connect the quality improvement ecosystem. And so we know that the QIP reports and use of quality improvement plans will help to serve as an integral role to signal areas of importance for quality improvement. So as we analyze the quality improvement plans that come in, we're looking for those areas where, okay, we're doing well, the metrics are good, but we're seeing additional indicators that maybe we need to focus our energy somewhere else. It certainly brings a common focus to important quality issues across sectors. So again, we're looking at across the sectors, where are the needs, where are there opportunities to be able to look at integration opportunities and supporting each other. Certainly an opportunity to provide information about trends, best practices, and experience with change ideas to providers. It's an opportunity for you to be able to not only examine what you've done that might have worked, but to be able to share best practices to the other organizations so that they can certainly start to look at those best practices for implementation, but also to be able to support each other in the fact that we don't want people spinning their wheels, and if there are particular indicators or particular change ideas, that you work on, If you can't really get traction and you spend a few months on it to find it really does not land us on any kind of improvement, that we share those opportunities as well. Some people say we share the failures. Well, it's not necessarily the failures, but those things that work and those things that don't work. So it's again that opportunity to be able to share the good and the bad, and to be able to learn from each other, so that we're not continuing to make the same mistakes. And then use data as a support for communities of practice or collaboratives focused on quality improvement. So certainly be able to work together to create those communities of practice. And then the quality improvement plan sits in all of these circles and crosses them all, and you can see that patient engagement and quality improvement is certainly across all of those buckets of work that we would be working within the quality improvement realm. So just some highlights from the 2014-15 submissions. We had 100% of hospitals, and of course they're in their fourth year, so 146 of them submitted their quality improvement plans. For the CCACs, this was their first year, so 14 of them are 100% submitted. For primary care, you will see there's 293, and you'll probably scratch your head and say, I thought there were more than 293 primary care organizations out there. But this is just the interprofessional team-based primary care. So your family health teams, your community health centers, nurse practitioner-led clinics, and the Aboriginal health centers as well. So again, a very small focus, and we know there's a much larger primary care practice out there. And then with the long-term care homes, there were 95 long-term care homes that submitted the voluntary submission last year, which represents about 19% of the sector. And just to give you an idea of the percent of long-term care homes that selected the priority indicators and the percentage of those 19% who are working on the indicators. So about 96% were working on falls, 92% were focusing on pressure ulcers, 91% restraints, 90% incontinence, 89% ED visits, 85% resident or client experience, and about 24% worked on other. And when we talk about other, so these would be the priority indicators for the long-term care home versus the sector priority indicators, which are the system-level priority indicators. And so just to give you an idea of what was included in some of those others, so some people chose to look at staff or financial-related indicators, medication or nutrition-related indicators, immunization or other infections, those types of things. So again, that's the area where you would really, for your organization or your facility, you would be really looking at what's important for us versus something that might be your falls or your pressure ulcers or any of the others there. So let's just have a quick look at the priority indicators for long-term care. So certainly falls, pressure ulcers, restraint use, incontinence. You've been reporting on those, and public reporting has been reporting on those for a number of years as well. So these are not new indicators for you. You're well familiar with those. Resident experience, potentially avoidable ED visits. These two were part of the voluntary submission last year, and they were developmental indicators through the year last year. So we've been working through the past year to really help to define which domains to be looking at in the resident experience and what those potentially avoidable ED visit conditions could be. And then new this year is the appropriate prescribing, potentially inappropriate antipsychotic use. So there are 7 priority indicators for the long-term care sector, and all of these are available in the indicator specification document, and that's available on the Navigator website or on the Ministry of Health website. And we'll show you where to be able to access those documents in just a few minutes. So I've taken the falls indicator and I went to the indicator technical specification document that I just mentioned, and I actually just copied and pasted in here what that looks like so that you can see what type of information is available in that indicator specification document. So you will get the name of the indicator, so this particular one is falls. You will get the quality dimension, so it's a safety dimension, and the definition, so percentage of residents who had a recent fall in the last 30 days. the additional specifications. So you'll notice that this indicator is not risk adjusted and represents a rolling 4-quarter average. So this indicator is consistent with HQO's long-term care public reporting website. However, HQO publicly reports on adjusted rates, and for the purposes of quality improvement planning, we use unadjusted or not risk-adjusted data to be used. And the reason we suggest, or that we take you to using the not risk-adjusted indicators, is because we know that within quality improvement planning, we do want to be able to see the gains that we're making with our quality improvement efforts. And with the non-risk adjusted rates, we really do see those changes that are occurring in a much more timely fashion. To be able to move the indicators at the risk-adjusted rates can take a significant amount of time, sometimes years and years before you start to see any change in them. And we do want in quality improvement to start to see those small incremental changes that are moving the big dot indicators, but it's a slow process. But in the quality improvement world, we want you to be able to see those gains that you're making. So the reporting period for the falls indicator for 15-16 is Q2 for the fiscal year 2014-15, and this is the April 1st to March 31st year versus we know that with long-term care home you operate on the calendar year. So just so you know that those reporting periods will be very explicitly explained in the indicator technical specification document. The data source is the CIHI CCRS reports. And how to access the data. So to access your organization's unadjusted rates for this indicator, refer to your organization's CIHI CCRS reports. So that being said, where possible in Navigator, where we have the data and the data is readily available, we will pre-populate those values where they are available and the most recent time period. So the Q2 fiscal year 2014-15 probably won't be available until mid to late December when CIHI refreshes their data, and therefore if you were to go into your Navigator now, you will not see a value there. But as we get the refreshed rates, we will certainly be putting those in to the current performance. So for restraints, pressure ulcers, and incontinence, they all look very similar to the falls indicator here. So I didn't bring them all up to go through them all in detail. I will spend a little bit of time on the resident experience and the ED visits and the antipsychotropic drugs. So the resident experience, so we had a lot of questions last year as to what do you want us to focus on. There are so many domains within resident experience that, you know, it really can become, you know, we could put in, and some homes did put in like 10 indicators related to resident experience last year. So in order to try and help to narrow the focus, we worked with the long-term care sector over the summer months to sort of refine where we are with some direction. So we landed on 2 domains, so having a voice and being able to speak up about the home, and the domain number 2 is overall satisfaction. We recognize that some long-term care homes use the validated survey tools, the NHCAPS, or the Interreg Quality of Life Survey, and they have questions specific to those survey tools, and so we've put them there. And for those of you who use your own homegrown in-house survey, what we suggest is, because we're nearing the end of the year, you've been collecting your data. We're not expecting you to start anew or start to ask these questions differently. What we're saying is, within the data that your survey tool that you already have, if you have a question that's similar to one of these 4 questions or one of these 2 questions in each domain, use the question that's most similar to either one of those that allow you to speak up about the home, or to be able to talk about overall satisfaction. And if you don't have a question that's similar, you can certainly add in a new indicator that, you know, is an area where you want to be able to focus for resident experience. And then what we're suggesting is for your survey survey next year, as you move to your next year's survey implementation, that you would consider one of each of the questions in the domain. So a similar sort of question in those domains. And then for the potentially avoidable emergency department visits for long-term care residents, we know that last year we had a lot of issues with this particular indicator, because for the majority of long-term care homes, the case-sensitive conditions that we were looking at, the acute case-sensitive conditions, the numbers were so small that it was suppressed. The data was suppressed for the majority of homes. So again, the Health Analytics Branch did look at sort of the data that's available. We did again consult with a number of long-term care stakeholders, and were able to settle on these 17 conditions, where for about 95% of the homes there is data available, and while there are still maybe a handful of homes where the data will be suppressed, for the majority of homes there was actually information available. So again, these are not carved in stone. We will revisit these next year. Are they the right mix? Did they resonate with people? And you'll notice that one of the big indicators, which you often hear with ED visits, is the UTI. And so the discussion with the stakeholders that we consulted with was that UTI should be taken out from this list, because it tends to be the default diagnosis for patients, or sorry, residents going to the ED, and that's generally not why they go to the ED from the long-term care home, but it tends to be the default diagnosis that they are sent back with, and there are some questions about the validity of maybe sometimes they're not actually a UTI, and if we were to make any changes on the UTI diagnosis as the diagnosis from ED, that it would be at the hospital or ED level that the most change and most education would have to occur, and that's not something that long-term care homes could influence. So again, that's why you're not seeing that one there. We do recognize that ED, we say potentially avoidable ED visits, and we do acknowledge right up front that not all ED visits can be prevented, and we know that there are a number of ED visits where it is patient or resident's choice or family or caregiver's choice that they insist that the patient go to the emergency department. And we recognize that and know that we're not expecting the potentially avoidable ED visits to be at zero, because there is that personal choice that's always can influence it. Well, let me just go back for 1 minute. So the data source, the Ministry of Health Long-Term Care, will provide organizations with this data via longtermcarehomes.net, and we're still waiting to hear back from the ministry as to where exactly on that website that this information will be housed, and as soon as that's available, we will put out a bulletin to the long-term care homes, and we'll make that information available on the Navigator's long-term care link, so that everybody can find that information. The appropriate prescribing potentially inappropriate antipsychotic use in long-term care. So it's a percentage of residents on antipsychotics without a diagnosis of psychosis. And again, it'll be the not risk-adjusted and representing the rolling 4-quarter average. Again, it's be the Q2 fiscal year 2014-15. The data source is the CIHI CCRS e-reports, and you can access your data from the e-reports, and again, where possible, we will pre-populate as we get closer to the April 1st timeline. So poll number 2, what data sources will you reference to complete your performance in the quality improvement plan? And please select all that apply. So Marg, we'll get you to launch that poll. And I'm just going to look at the questions while Marg is doing that to see if there's anything that we need to address. And it looks like we're okay. I'm not seeing any questions that are worth sharing. So Linda, just for my own sake, were people able to get on? It still looks like a few that are not connected, but hopefully that you're able to work through that with them.
Hi, Trish. We haven't had any further comments, so we're hopeful that they have been able to get on via phone and maybe didn't enter their audio pins. Just hoping. Some have signed in twice, so that might be the reason. And it looks pretty quiet on the question front.
Yep, no, we're looking good. Okay,
Yeah.
how's that poll going?
So the poll is going in just a few more seconds. So I'll be posting that up very shortly. Alrighty. And be able to see the results. So good to see. We have 93% are with the CIHI e-reports, 56 with the HQO public reporting, 73 with in-house, and another 17% with other.
Excellent. So, people are familiar with, or the majority of people are familiar with the e-reports, with the HQO public reports. Identify that some information does come from organic or local in-house data, and that there could be other sources for data as well. So that's great. Thanks, Mark.
All right.
So I do see a question there that says, I have a problem with this, so this is the antipsychotic drug one, as a drug like Haldol is great for nausea for the elderly. And again, remember that you do have that opportunity within your quality improvement plan that you can certainly add your comments to say, that why this is a problem, how it's affecting your numbers, so you can actually review that data and see where it is that this component of that population that are receiving Haldol, that maybe it's a small number, or you can justify it or validate it or talk about it in your actual work plan. Okay, so the introduction to the Navigator, and again, I'm just going to walk us through it a little bit. Mark is going to take us through a live demonstration shortly. So if we go into to the Navigator website, you can see at the top you have Home, Resources, and Sector QIPs. If you select the resources page, you do not have to be logged in to be able to access the resources that are there. So you'll find your Quality Improvement Plan guidance document, and the indicator technical specification documents are listed here. You can see they're in English and French. You just pick on which one you want. The guidance document is a common guidance document for all sectors, so it's not sector specific. It's the same for all sectors. And then for your technical indicator specifications, page 22 is where the long-term care sector priority indicators start. So again, you may want to, if you're doing some work with your hospital or with the health links or with your CCAC, you can certainly see what their priority indicators are as well, and see if there are areas of common goal that you might be working on, or where one may complement the other, and you may actually find some change ideas that could be generated across the sectors. So that's certainly there. The Health Quality Ontario analysis report. We did do an analysis report on the 95 submissions last year. We're hoping that will be available for release and review around mid-December, another couple of weeks, and that will be posted on the resources webpage as well. You'll find other resources are available, so links to web links for other resources. Frequently asked questions, you'll find when you go there, there is a long-term care and each sector-specific frequently asked questions, as well as general asked questions about quality improvement. And there is also a tutorial. So that's a Navigator tutorial, which allow you to familiarize yourself with the various components of Navigator with some nice screenshots and those types of things. So then if we click on the sector-specific link at the top, you'll get a pull-down menu that gives you an opportunity to be able to look at the fiscal year. Remember that we've had the hospitals who are in their 4th year, long-term primary care that's in their 3rd year, or will be going to their 3rd year, and CCACs, which will be going to their 2nd year. So you can view all. You can select by sector. So if you pull down the View All tab, you can go to just CCAC. You can leave it as all. You could go to just primary care. After next year, long-term care will be here as well. And then the LIN, you can sort it by LIN. So you could leave View All and select your own LIN, and then it will just be those health organizations within your LIN. And then by model or type, so that could be primary care, could be family health team, could be a CHC, whichever you choose, as well as large community hospital, small community hospital, whatever the types are within the various sectors. And this certainly allows you to be able to view sort of the work that's going on in your region. You can see that you can pull up the narrative, you can pull up the work plan, you can pull up the progress report. So again, you can look to see what type of change ideas they were working on for which indicators, those types of things. And a reminder that again, you do not have to log in. This is available for the public, for the sectors, for organizations, anyone who's interested in looking at these. So when you get into the getting started to the home page on the QIP Navigator, you will notice that there's a username and password required to log in. So each organization, so each long-term care facility at the facility level was provided with a unique username and password last week. That was sent to either the CEO, administrator, whoever the lead of the organization or the facility is, was sent this password, username and password last week, as well as where we had on record a quality improvement lead or quality improvement contact. We did copy those on the emails as well. If you are not able to find who has your password, or if your organization, within your organization, it doesn't seem to have reached the right person, again, because we know that there is turnover, so the CEO or the executive director or the administrator may have changed, and we just didn't have the most current information. Please contact us at QIP, QIP at hqontario.ca, and let us know that you're unable to find your password. We'll either tell you who it was sent to, or we'll be able to provide you with the actual information. Once you're logged in with your password, you will be required to change your password, and then that becomes the responsibility of the organization to decide how you're going to share that username and password, so that if you have a quality improvement committee, you may want everyone to have access. You may want specific persons assigned, that type of thing. If you're with a corporation, the corporation will not receive a password. It is the individual facility that receives the login information. And again, it becomes up to the corporation how they manage all of those facilities that might be part of their corporation with their login. And we do have a Forget Your Password button at the bottom. You can click Remember Login, so you don't have to go back each time and log in with your password, or you can click on Forget Password. For those of us, because of the number of passwords we live within, sometimes it becomes hard to remember and manage. Or again, you may have the person who was responsible may change positions or whatever, or move on, retire or whatever, and you need to be able to have it reset. So that option is there as well. So once you're logged in, you come to this dashboard, and you will see for long-term care homes that there will be the 2015-16 year is the only year that's available, again, because the long-term care homes did not submit, who submitted voluntarily, did not submit through the Navigator last year. So when you come to the front page, you'll see your name. So when you come here, it should be your long-term care home that is listed here as the name. If for some reason when you log in you get the wrong name or an incorrect name, please let us know again through the and you can see that you have an edit and submit button here. You have the dashboard that says the in progress and the number of sections complete. I will caution that when you go into a section, even if you only type in one word, it comes back that it's complete. So I'm not sure complete is the right word we should have there. But what I want to bring to your attention is it means that it has been accessed and there has been data submitted. It doesn't examine it or say in any way what the quality of the submission is. It just says that something has been entered. So, so if you were a hospital logging in here, you would be able to go to your fiscal year of your past 2 years quality improvements would be listed down here in view only. So again, you have an archive of being able to go back and look at previous years. You can certainly edit your quality improvement plan as much as you want until you're ready to submit. And just a word of advice that don't be afraid to press submit. There is an opportunity where it gives you whether or not all sections are complete or if there are areas that you need to complete before you submit. So it's almost like a little check spot so that you're not just hit submit and it's gone. And also, once you hit submit, it will come bring up a screen where you have to confirm who has signed off within your organization. So the most senior person within an organization or within the long-term care home is responsible for, we don't put the signature in, but you put their name in, indicating that they are aware and have signed off on the quality improvement plan. And we do advise that you actually get their signatures and keep that copy as a document within your organization so that you have it to refer back to. So I see a couple of questions there, Mark. So did I just hear that corporations will not have access to the information for all their homes? We do, well, the information is sent out to the long-term care facility level. There's certainly no reason why they can't be shared at the corporate level, but there is some concern that that if there are a number of organizations, a number of facilities within a corporation, that it is at the facility level that the quality improvement plan is submitted. So there may be common indicators that you're working on, but if there are 10 long-term care homes within a corporation, there will be 10 quality improvement plans submitted. So it is submitted at the facility level. So just to give some clarification there. So when we go into the our QIPs tab at the top, and you access your quality improvement plan, again, your name should come up here. You'll see what year you're working in. And you'll see that there are 3 tabs that you can choose from up in the far right-hand corner: your progress report, your work plan, and your narrative. And so usually we go to, it defaults to the narrative screen, but certainly the progress report is where we would recommend that you start your work. For long-term care homes for the 2015-16 year, you will not be required to submit a progress report, even if you voluntarily submitted last year. And the reason, again, is because you didn't submit through the Navigator, and you weren't required to last year. We were still building it. So I'm just going to walk you through the progress report, because I do want you to start to think about how you're monitoring your quality improvement plan, and be prepared for next year. You will have to submit a progress report. So right now, when you're in Navigator, you click on progress report, you will get no records exist in the database as your organization's QIP was not submitted via Navigator last year. But I have taken snapshots from others just to be able to give you the type of information that's available within the progress report. So you can see that what will come up is a progress field that lists, so it pulls your change ideas from last year, will automatically be populated into this progress report. Then there'll be an area where you can click whether or not you've worked on that, implemented that change idea as intended, and then there's an opportunity for you to be able to talk about your lessons learned. So what worked, what didn't, and again, we really do talk about what didn't work as well as what worked, so that so it can become a learning opportunity for yourself and others. So next we're going to look at the narrative. So the narrative, of course, when you click on that, this is the page that will come up. You have an opportunity to be able to upload your organization's logo. You can export your narrative to a Word document. So those features are available for you. And then within your quality improvement plan, if you click on so the overview, or you can click on within this box, there's a plus sign in the middle. This will give you the text field where you can actually type in the information for your overview. The question mark, you'll notice that throughout Navigator is available with just about every title that you see in the Navigator, and this provides you either a definition or the type of information that we're looking for, or any other pertinent information that may be related to that actual title. So you can see that for overview, the objectives of your QIP for the following year, and how your QIP aligns with other planning processes in your organization, including your strategic plan, your operational plan, your service accountability agreements, accreditation requirements, and any other contractual or accountability requirements. So that's this is a list of the various sections within the narrative. So you have your overview, your integration and continuity of care, challenges, risks, and mitigation strategies, your information management, engagement of clinicians and leadership, the patient, resident, client engagement, and accountability management. And as I've said, this is a standard document that all sectors will complete. So the patient, resident, client engagement is a new section for all sectors this year. And again, when you click on it, it gives you your pane for being able to insert your information. It allows you to add information to describe how your organization engages with residents, patients, clients, and their caregivers, and the way in which these engagement activities inform the development of your QIP. So you know, how do you involve your resident council? How do you involve your family council? From past experience with some of the other sectors, they actually have focus groups with clients or caregivers, where they actually present a draft copy of their narrative and their work plan and ask for feedback. And we've heard back from a number of the organizations that it's quite useful, because things that we tend to focus on, they certainly sometimes have a different view of the world than we do. Sometimes the jargon that we use, because we're close to it, becomes, well, I don't know what this means, so it really doesn't have value for me, those types of things. So again, we encourage you to look for those ways that you will engage the residents and their caregivers and families, and be able to describe it here in this section. So then we're going to go to the work plan. So when you open the long-term care work plan on the top of your of the Navigator screen, this is what will come up. You'll be able to scroll down, and you'll get all of your the priority indicators, which will be in red, and in the measure section, they will also be in red. If you add a new indicator, they will come up as black. So I'm just letting you know. You can see very quickly at a glance where there are changes. And so the priority indicators, as I just said, will be in red, and the others will be created in the add a new measure down here. So if you decide that you want to, so let's just take the first one here, reduce worsening bladder control, and the percentage of residents with worsening bladder control during a 90-day period. If you decide you want to look at a 60-day period or a 30-day period, or you want to change the actual source period, so if you want to say, we want to look at, we have data in-house that's last month's data. You might want to say, well, okay, that's what we want to work on. You just add a new measure, and then you can add in your information. So when you click on any of the blue section here, it will bring you to this section, and then you will get your pop-up screen that if you're working on the indicator as outlined in the indicator technical specification document, the grayed out areas will have the actual unit of measure, the population, the reporting period, the data source, and all of that will be pre-populated, and you can't change it. You can't override any of that information. Your current performance, until we actually pre-populate it, you can put in your current performance in this box here. Once it is once we get the refresh data from the e-reports or from the health analytics branch, and we populate this with that data, then you cannot override it to add in. If you want to change it because you have a different number that you want to use, you would have to add that add additional indicator, and then when you do that, you have an opportunity with a clear field where you can add in whatever you want, but you do have to fill in all of the sections that have an asterisk have to be completed before it will allow you to submit later on. So poll number 3, Mark, are you ready to set up? Have you considered what change ideas your organization can implement that will result in improving performance? I'm just going to check to see any questions there, Mark. That's once you get the poll set up. Are there any? Sorry about that. Knocked something over. Any questions, Mark, of particular interest that you want to highlight for the group so we can talk about it?
Well, there was some talk about board approval before submission.
Okay. So, so again, we recognize that within long-term care homes, not every long-term care home has a board. So if you don't have a board, what do you do? Because you do need someone who's signing off. So it would be the senior team or the owners group. If it's a municipality, it would be the highest level of authority within those models or structures who would sign off. And the reason that we look for that highest level of authority as a sign-off, as a signature for you to be able to have it, is so that is their commitment, that they really do commit to the quality improvement initiatives and changes that you're suggesting. So we do encourage at this point, while it might seem like we're months out, we know from experience with some of the other sectors that the board or the the corporation or the senior team or the administrative team may not necessarily meet on a regular basis. So you need to be able to look at what's the latest date that they're going to meet before that April 1st timeline for submission. You need to get it in their calendars now, so you know when you have to have your quality improvement plan ready for approval or for their input. And so get that date and time in their calendars so that you have plenty of time to be able to work on any changes or things that they may come back with once they give you some input and feedback, and gives you time that if it needs to go back to them again for approval, that you build all that in. So you need to understand that at your corporation or facility level what that process will be, and we do suggest that you try to get that into a calendar so that people are well aware of why that's there and you know what your timelines are working forward. So I see another couple of questions. It is easy to add change ideas if there's a leading practice, and not so easy if the project is looking at improving dining. And yes, so again, when you look at your quality improvement initiatives that you're going to be working on, you really need to have that discussion with, are we going to be looking at priority indicators within your organization, such as the priority indicators that are provincial, or others that are priority. And while a change idea related to dining, it may be that you would be looking at things differently. If it's a major issue and you have a lot of work to be done in your dining area, it may well be a priority for you. And it may well be that you need a phased-in approach, that it's going to take you a while to really work and improve on the dining experience. And you may need to develop a subcommittee. You may need to develop a quality improvement plan. It may take you a year to implement it. You may decide we're going to focus on one particular area of the dining experience. So, it might be you know, sort of as they arrive, or selection of their meals, whatever. So it could be as big or as small as you want to make it, and that will certainly influence whether or not it's a quality improvement indicator that you actually want to put on your quality improvement plan. That's a system-wide and organization-wide focus. So, and I think this is a continuation on from the previous part, and the team is not clear what some of the root causes may be. And don't forget that your quality improvement initiative may be that you actually bring together focus groups or small working groups to actually look at what those root causes are. So, you know, you're going to do process map, you're going to do 5 whys, whatever, and you're going to take a month to do that because you want to get all staff involved and those types of things. That could well be your first quality improvement change idea, is to look at all those things that you need to do. So, Mark, how are we doing with that?
I think too, Trish, with the quality improvement plans, what we're expecting will happen as well is that as we see the information in the progress reports about what works and what doesn't work, that we will be able to share what these new emerging leading practices are and results from the organizations to build some solid information about that. And certainly agree with Trish about the root cause. Sometimes it's just you need to develop the change ideas before you get to actually doing some testing.
Right.
All right, I'm going to pop up this poll, and so it looks like most of our crowd today, so 84%, have been considering the change ideas. 2%, probably one person, has not, and 14% hadn't really thought about it yet.
Okay, so a good number of you have already started thinking about them, so that's good. And for those of you who haven't really thought about it yet or not considered them at all, that you know, hopefully we'll provide you with some resources and opportunities to be able to get you thinking along that line. So just so that people do know, all of the Navigator resources are available. They were made available on Friday, and on the Navigator, the resource link that I showed you, the guidance documents and the indicator technical specifications are the new release for this year. So all of the materials are available for you there. So when you click on the green section of your work plan, you'll certainly get your plan improved initiatives, your change ideas. Then there's a method section, there's a process measures section, the goals for change ideas, and a comments section. And you would click on add a new change idea, and that will bring you up this screen, which again allows you to be able to see what it is you're working on, and it is the priority indicators that we do default to. Your long-term care home name will be there. You will see a grayed out area for the change number. Don't worry about that. If you add a new change idea, it will automatically number them. So if you have 5 change ideas, and every time you click add new change ideas, it will number them appropriately. So you will have, again, you see the question marks that allow you to get all those, understand what all these mean. So you would be able to type in your planned improvement initiative, your methods, your process measures, your goals, and your comments. And again, until you actually submit it, you can go back, you can start with your planned change idea, planned improvement initiatives, your change ideas, and start to populate these. If you decide in 2 months' time, you know what, we have 6 in there, and we're really only going to focus on 3 of them, you can just go in and hit the bottom button to cancel it or delete this change idea. You will note that you won't be able to change, you won't be able to delete any area that is grayed out. That will automatically delete if you delete the change idea. So again, it gives you opportunity that you can use this as your your work plan to be able to go in and add to it, take away from it, refine it, whatever it is you want to be doing with that particular change idea, and recognize that that once you actually enter your data in your work plan, when you say save and close, it goes back to the full work plan, and on the far right-hand corner of the top of the screen, you will be able to export that work plan. So if you've been working on it for a month, and now you have your small team or your QI committee coming together, and you all want to have a chance to look at it, you can either bring it up as a live demonstration and talk about it, or if you have people who prefer a paper copy, you can download the work plan, and people can then have input and discussion into it. So one of the documents that we do have available is the change concepts and ideas. So it's a quality improvement primer that's available, and certainly the links for that will be in the resource pages. So, so we recognize that the change ideas are actionable steps for change, and they're targeted at improving specific processes. They often originate from best practices, brainstorming, creative thinking by frontline staff, providers, and patients, and certainly as per Heather's comments, with looking at getting at root causes and how do you start to understand where to start your improvement initiatives. So if someone who's not at the frontline level decides we're going to do this and we're just going to implement some action plan without consulting frontline staff, without consulting the providers and potentially your residents and caregivers, you may find that that you don't get buy-in. It may be you're focused on the wrong thing. It may have seemed like that was the area of concern, when in actual fact, a few layers down, you would have discovered that that wasn't the real issue. There were other things that you really needed to focus on. So again, looking at your change ideas and certainly understanding those root causes. Why is it an issue? What's really happening? And from the frontline staff and providers, you will generally get different ideas, and ideas that, remember, they've probably been looking at it as well, so they probably do have some idea of a simple little tweak to something may make a huge difference. So again, involving them and getting input certainly does help to generate those change ideas. So within your work plan, the process measures, so we look at two particular aspects of an effective process measure, and that's the change ideas. So the change ideas need to be have goals that are what we call SMART. So they're specific, measurable, actionable, realistic, and time sensitive. So when you're developing your work plan for your change ideas, looking at what it is you're trying to accomplish, how you're going to accomplish, what's the measures that you're going to use. So what's your measurement plan? Where are you going to get that data from? How are you going to action it? Who's going to be doing it? Is it realistic? And is it time sensitive? So is it realistic that you're going to implement XY initiative and you want it done in 2 months? Is it something that can really be accomplished? And do you have a time frame up so that if you're going to post your work plan within your work area, and let's say the PSW is going to collect this information every Friday or provide this information every Friday to the quality lead, they need to know what it is you're trying to measure. At a quick glance, they can look at it and say, okay, this is what we're going to do, this is how we're going to do it, who's going to collect it, how we're going to collect it, what we're actually collecting. And I know that it has to be done monthly or weekly, and I know that it's going to be over for this phase anyway by February 1st, so that they know what the time frame is for this activity to be going on. And then there are informative comments that you will put in your comments section that include factors for success and additional information describing issues that may impact improvement activities or targets. So if you're talking about, let's say, you're implementing to help prevent falls, you're implementing some sort of mat or assistive device, and you know that it's going to take you 4 months to get these in place and staff education completed and all those types of things. Well, if you're going to put those in place, and you're submitting your quality improvement plan for April 1st, and you know it's going to be September before they're actually in place, you would use your comment section to say, we're not actually going to start looking at this until September because it will take this long. Training is planned for the months of July and August because staff are on vacation. We know that will take 2 months before all staff have been trained on this particular assistive device. So that's the area where you can describe what's happening, describe those things that you're concerned about. You might want to put in your comments section that for the change idea that is related to a particular indicator is really contingent upon a previous change idea in another section. So if you're talking about your, and again, I'm just thinking out loud, if you're talking about you're going to be preventing your falls and you know that you're looking at, first of all, your antipsychotropic meds, you may want to say that this change initiative that we're talking about here is dependent upon the information that we find out with the root causes with our medication review that we're doing. So again, you can stagger your process measures. You can stagger your change ideas. If they build one upon the other, and you know that it's going to take a while to be able to get them, put that in and put your time periods that are realistic to those. If it is a major initiative and you're a really big home, and you know that that each wing or each floor or each area is going to have its own unique challenges, you may have a great idea that you're going to say, we're going to start it here in this one particular area, and then once we get that working well, and we've seen the improvements that we hope we will see, then we will look to sustain it and spread it to other areas. And it may take a 3-year period that you're going to say it's going to take us this long to get it across all of our homes or across all of the areas within the home. And again, you're building up on the work that you're doing. So again, think about your change ideas. Think about your work plan. Think about the work you're going to be doing. Are they interrelated? Are they dependent on other things upstream, downstream that you really need to think about? And can they be staggered? So that one happens logically after the other, so that it gives you a good direction, and you don't feel like, oh my gosh, I'm trying to work on all of these at once. We don't have the resources. We're trying to monitor those types of things. How are you going to actually do that work plan to make it actually come alive? So think about all of those things, and certainly think about your SMART goals. So again, I've given you an example. So I've just pre-populated this. It's quite small on the screen, but certainly we will be sharing the slide decks with all of the sector after next week. And the reason I say after next week is that they actually have to be translated before we can post them. So they're in translation now. So again, the example I've given here is really looking at developing a fall strategy. You look at the method of how they're going to do it. So they're going to look at the previous 6 months. It's going to be a number of falls in the past 6 month period, or the number of falls charts reviewed in that period. Then by June 30th, 2015, the Falls Prevention Subcommittee will present their findings to the larger Falls Committee. And then the comment says, that we will be working with the frontline staff to develop actionable fall strategies aimed at reducing falls. Then the number 2 change idea would be looking at specific areas of whatever that plan is or that strategy that you've developed, and how you're going to implement it across the system, and how you're going to do it, who's going to do it, when are you going to do it by, and when are you going to complete it by. So those are the important things that we really want you to take away, that you do have measurable time periods, that they are realistic, and that they're certainly time sensitive. So poll number 4, which is also the last poll, which of the following attributes is not included in the definition of a SMART goal? So Marg, I'll get you to launch that for us.
There you go. We'll have a little look at questions. I don't think there's anything in here that's new, but just to reinforce that the Navigator is a private workspace under a password-protected area until you press the submit button, and then it becomes available on an all QIP page, all sectors. And then people would be able to view it and download it at their leisure.
Right.
So this one I think is pretty simple, Trish. I'm going to close it. It looks like we have, I think this is the best we've done. So
good.
We have 100% have chosen monthly.
Good.
So
people have been paying attention, but as I keep saying to Marg, measurable, monthly is a measurable time period, but we're looking at measurable as in it could be monthly, it could be daily, it could be hourly, it could be yearly, you know, so again, monthly could be a measure, but it's not the only one. So great. Good job, guys. Shows you were paying attention. So just before we go to the Navigator, so this is the cue for Marg to get ready to bring the Navigator up. I just want to bring up on the HQO website, you'll certainly be able to find under quality improvement the residents' first information, so that information is still available for you to be able to access. The QIP analysis report, so as I mentioned, we will have the long-term care QIP analysis report will be available in just a couple of weeks, so keep an eye out for that. And you may be interested in looking at some of the analysis reports from hospital or primary care to see the types of trends and information that has been available and seen. The QIP inbox, so QIP at hqontario.ca. If you have problems with your password, if you have questions about your actual quality improvement plan, if you're not able to find things that you thought that were available, or you thought you'd heard that you mentioned this, could you direct me to it again, those types of things. Any questions that you would have, certainly direct them to QIP, and Linda will direct them to one of the specialists, and we certainly aim to try to respond to you within 48 hours of receiving a question. And if we can't answer it and it's more appropriately answered at the ministry level, we'll forward it on to them as well to get their input. So we're getting the right source to be able to give you the correct answer. Recognize that if you submit a question at 5 o'clock on a Friday afternoon, you may not get an answer back till Monday, but I know that I say it may not. Usually what I've seen is a keen bunch that I work with, that they usually do respond to you over the weekend, so keep an eye to it that way. Certainly as we get closer to submission time, we tend to be on high alert to make sure that if you are experiencing difficulties, that we're there to help you as quickly as possible. And then the QIP Navigator link, so that you can actually connect to the QIP Navigator. So Marg, over to you.
All righty, I'm just changing presenters.
Okay.
So my alias, my name's Marg, and I'm under the QIP personality today. So I'm in the Navigator. This is a staging site, so this isn't the active site. As you're aware, the real Navigator has been launched, and so we don't want to be playing inside of any of your QIPs. So we're using the staging site for this. But so you all would be given a username and a password. Prior to that, though, I'll just let you know that the resources and sector QIPs are not password protected. So you can go into the long-term care sector resources. You can go into any of these, primary care, other resources, so forth. The guidance material is posted here. It's an evergreen document for all sectors. Technical specifications, a critical document with all of those definitions that Trish has shared with you. I'll give you a little taste of this checklist. So we heard a lot from your sector that you were looking for something that was very easy, quick reference that would have actual links in it. And I'm trying to get this to shrink, but it doesn't. There we go. So it has sort of all the phases. suggesting you start your planning now, right through to when you have sustainable plans and implementation plans going forward, and communication and talking about spread plans. So really quick and easy, but does link to the Sentinel documents that you will need in order to complete a quality improvement plan. There is additional information about the resident experience questions on this appendium to the guidance documents, and I think people will find that particularly helpful. It's been quite remarkable to see people coming together and agreeing about what is important, and to just get started with having common indicators for measuring resident experience. A lot of you may be familiar with the Quality Improvement Compass. Probably most would be familiar with the long-term care button, but you may want to look under some of these others: home and community, person-centered, transitions. They all have components that you might be particularly interested in. Let's look at one that we haven't had a look at yet today, Trish. So it kind of gives you the call to action about why that would be important. You'll see up at the top there are different tabs. So one that is most commonly used, or very commonly used, would be best practices. And in the quality improvement plan, it's called plan change initiatives. It can be called change ideas, evidence-based practice, evidence-informed practice. There's, better practices, but looking for those ideas that have some literature that, support that this would improve the care for your patients. So let's have a look in this one. So it's saying it's expert opinion, and they have described how they rank it. Arrange for routine tests in-house. So we know a lot of people end up going to hospital for diagnostics, and particular to lab. So there's some examples here of tools that might be helpful. There are references to get further information on some of these ideas. There are also examples of measures, so you will see some process measures. A lot of people are having, might not be familiar with how to phrase certain indicators, so here's some examples that would be related to change ideas. And again, sort of the more fulsome tools. And success stories. So we hope to see lots more of these as you're working on your change ideas and have those successes, or perhaps things didn't go so well. We also want to hear those stories as well, so that people don't have to learn those lessons the hard way, shall we say. Okay, back up to our resources. Links to the QIP reports. Again, you're using unadjusted rates in the priority indicators, and some description about what those differences are. So there's other resources, kind of generic quality improvement. FAQs, we'll be updating these as we go along. So for example, from this series of webinars, we'll be developing some additions to this QIP. As well, there is a tutorial or a user guide to Navigator, which takes you through with lots of pictures and descriptions on how to do a quality improvement plan. So more on the technical than on actually the quality improvement. We're expecting a video to be available here, as well as the webinar from today, or we get to pick. Trish has the hard task of picking from 7 that she's done in the last week and a half to figure out which one will go up there. So next tab, sector QIPs. So this is where it's really a learning environment where you'll be able to sort QIPs by LINs, by model type. So it could be different types of hospitals. If you want to reset, it goes here. There are community care access centers on there now. I feel like it's kind of like we're whirling. So again, you can reset. And so you can also go by your model type. So perhaps you're a mental health hospital and you want to look at, or you're doing a mental health program and you want to know who's doing work in mental health. These might be areas that you would be looking at. So again, you're able to actually go right into their submissions and see what it is that they're doing. And so this is an example of a mental health from the Royal. So talking about medication reconciliation in the geriatric program. So some of these things may be quite related, you know, use of physical restraints, may be related to ideas that you're working on that you might be wanting to look at. Also, if some people may be working in health links or different partnerships where you might be interested in what your partner organizations are doing. All right, back to the login page. Any questions so far, Trish, as I log in here?
No, we're good. Yeah, I think we've answered everything that's there. We talked about the slide deck being available and the video being available.
Okay, so everyone should have been sent their login and passwords. We did get some bounce back, so if you're new to the position or there's been changeover in accountabilities, you can again send that to QIP at hqontario.ca, and we can update our contacts. So our QIPs is going to be a space where you'll be spending probably the majority of your time. And you'll see here the 1516 templates. This will be able to collect QIPs over time, but this year we just have sort of this coming year. So you press edit. In future years, you'll be looking at your progress report. For this year, I would suggest that you may want to review what your current status is on all of these indicators and review what you've been doing in the past in regard to these indicators. A lot of you have been working on these for a long time. You may have ideas of, you know, what you do not want to try again or anymore, and you may be refreshing your ideas about new ideas to try. In the future, you'll be asked to put in your current performance, and this also will be going into your work plan current performance. So current performance in the progress report equals to current performance in the work plan. These will also be exportable in the future. On to the narrative. So again, these will be public documents. So consider the language that you're using. We're certainly big on acronyms in quality improvement, and I'm a nurse by background, so that probably makes me even worse. So we're looking for concise descriptions, and Hover Help will tell you sort of what is to be covered in these sections, and you can use the X to move these boxes around and then to be able to actually write the information into these boxes. So for example, the overview covers alignment with your other planning, strategic plan, operational plan, service agreements, and accreditation. So we're looking for crisp, clear information about this. We don't need sort of a huge document. Initially, when we were talking about the narrative section, it was suggested 2 to 3 pages. And I don't think Trish or I have ever seen a narrative that was that short, but we've also seen ones that are 30 pages, and you know, that's really hard to get to what is the essence of your organization. This is really about what is the context that quality improvement is taking place in. So we want to be able to understand, you know, what are the factors that really influence quality improvement in your setting. So we know, like, your partnerships and integration, different challenges that different geographies or populations may be making for you. You know, your information system, is it integrated with any of the other systems? Engagement of clinicians and leadership and accountability. Trish talked about your boards and sharing information. And this new section, which I think long-term care has been doing a wonderful job at, we're really engaging residents and caregivers and families in care, and now, you know, looking towards being involved in quality improvement. So demonstrating that publicly is a very exciting opportunity. So again, this upload of your logo, that's the only place for a picture. This year's version will only take simple text. It will not allow for sort of that snazzy formatting. It exports into Word, so I'll show you how that works. So that if you are working with your board or your team, you can take it out and work on it. It's important to remember, though, it does not upload back in. So this is what it would look like. So your logo would be over on the main page, and you would have this available. And this is just to show you that you would have, in the paper version at your organization, you would have a physical sign-off of the document, but in your submission you would be just putting the people's names into the software and stating that they have reviewed and approved the organization's quality improvement plan. All right, so the work plan, and we have half an hour left, is probably where you will spend a lot of your time. So just to go through, so there's an aim, which is really similar to in the model of improvement. What are we trying to accomplish? So it's to reduce falls. Priority indicators are identified in red, and they're the only ones that are visible on the template. Just a reminder to see this ID, the black ribbon on the left side. It provides you with a number associated with this indicator, and this is to do with if you run into submission details, it will identify you as indicator 1 and tell you if there's a particular column that you may be missing data in order to complete your submission. All right, so we have an example of balls. We have, okay, we have done something on quite a number of these, Trish.
That's an important one to show, is that, so if you've decided, not the falls one, keep going down.
All right.
So the falls one is just the information that I showed you earlier. So just go down to the next one. So we have to reduce worsening of pressure ulcers. So if, let's say, you perform really well on your pressure ulcers, so you get either a suppressed number in your data, which means that it's less than 5. So for confidentiality purposes, there wouldn't be a number put in there for you. So if you're less than 5, obviously you're doing fairly well. So you may decide that okay, you know, this really isn't a priority indicator that we need to be working on. We know we do well in this area. So you would just not complete anything other than it would already be suppressed. It would already be linked as suppressed if your current performance was 5 or less than 5.
Except that we will not be pre-populating until, or from what I've understood, until mid-February. So updating those values, but so it may be in there or may not.
And I think some of the long-term care homes who've already been into Navigator have indicated it's not there. They are empty fields right now, and they did hear us say on the webinars that we would be pre-populating. So we just want to clarify that until we actually get closer to the actual submission time, we want the correct reporting period. So you will be able to put in a number, your own number that you're working on. But once we get the actual refresh data from either CIHI or the Health Analytics branch, when we pre-populate it, it will override what's in there, and you will not be able to override the data when it's put in. But for your planning purposes, you can add something.
Mm-hmm.
So what Marg is showing you, so you've decided you're not going to work on this. So what we would look at is, so you will see in the existing indicator, you do not complete your change ideas, your methods, your process measures, or your goal for change ideas, but you do put in your comments. We are not working on this as we are above the provincial targets, or we are sustaining our gains and plan to focus on whatever. If you decide not to work on a priority indicator, you are required to complete the comment section in the green side of the work plan. Otherwise, it will not let you submit. So I just wanted to highlight that one because that's an important one to know.
Mm-hmm.
Okay, so go ahead, Marg, and you can go into another one and partially complete it or something so we can show.
Mm-hmm.
But before you go there, go into your the absolute target and relative target and talk about those so people will understand what we're talking about.
Okay, so I can do that in here.
Yeah.
With our physical restraints. So not that I'm an expert on this, I'm just looking at some of, this is adjusted data that gives some values with Ontario being around 11, but quite a lot of variation. Central West is 4.8 to as high as 16 in some other areas. So let's say we're not doing so well. Maybe we're in 16, and maybe I just randomly decide that I want to do 12, because I know that lower is better. So let's see what happens if we do that. So although it's only 4 percentage points, it actually is a large change. So if you look at, there's this relative target, which will give you the difference between your current performance over your target performance stated as a percentage. And I think it really helps people when you understand that sometimes those percentage differences aren't that high, but you may want to be spending more time thinking about what the relative change is. Just to let you know that each of these hover help has a little description about what should be in those little boxes. The gray ones you cannot change because they are priority indicators. If you do want to change the population or the unit of measure or the time frame, then you have to create your own indicator. So again, this is going to tell you where this information is. Some tips about it. And you may, in some of them, see targets inside the target justification where it is available. So there are a number of sources that you could be looking at for target justification. So there may be a LIN value to consider. There may be from the e-reports, your past, your history, how have you been doing in the past. There may be, literature that you have seen that, if somebody put your certain program in and were able to get 50% improvement. So it's your choice to be putting in your targets, why you are putting in that specific target. I will save that. All right. And then you're planning to work on this to do the improvement. Tip, you cannot write in this change idea 1. It will populate after you save and close it. I spent some time trying to figure that out. So, so as far as this goes, there may be helpful if somebody could chat in some ideas, but maybe it has to do with, actually I think we heard somebody talking recently about the regular toileting program, because they found that if they were doing a regular program, then there would be less people trying to get up and to having to be restrained. So, and we certainly know that the restraint use interferes with, skin and causes more agitation and then maybe more medication. So that might be something that you're looking at. In your methods, you're going to do step by step. So talking about which staff are going to be involved in this, where is it a certain unit that maybe they have a high amount of restraint, when maybe you started on a specific shift for your first test of change, like days or evenings, and where's the documentation or the measurement plan. So somebody's got to be able to know that this is going on and to evaluate it. So, like, who is restrained when, why, do some root cause at the same time, maybe. So as far as this process measure, it could be a training program. So maybe the first step is training staff on a regular program. So the process measure may be number of staff trained on whatever the program is by December. And then your specific goal would be that you want to have 100% of staff trained by December 21/5. And you may even be more specific and put, as documented in your HR files, or you can put in the comment section if there's confounding factors. So it could be something that is really exciting and it's going to positively impact it, or it could be something that may not be so positive. So maybe you have new residents or students doing a project that wants to help with this. Or it could be that you know that you have a unit closing from May till September, and that would cause some issues. That may not be the best time to be doing it, but to just putting those notes in that would help to explain about what your choices are and things that you might be wanting to share in the future. Wait, is there people who would like to see other parts of this?
So Mark, one of the things I'd like for you to put in is to just pick one that we haven't looked at. So this one here, percentage, I can't make it, yeah, this one.
Out here, yeah.
Yep, so let's just pick this one. And we're going to put in, let's just put in a target. So let's just say the current performance is 90%.
Mm-hmm.
And we want to make it 95%. And I want you to save and close. I don't want you to put in the target justification. I want to show so that when you actually try to submit it, what areas will show up, so you'll know how to go back and you'll be able to see that on the screen.
Okay, so this is indicator number 8, everybody.
So let's just go to the change ideas for this indicator.
Okay.
And let's just put in XYZ for the change idea. So just to show what happens. And leave the process measure and just go, the method is good, and just put in goals. And let's see what happens when we try to submit it. So just put in, yeah, whatever. It's just to give an idea so that when you do go to submit, so it's number 8 that we left like that. So show them how to get back to submitting.
Okay, yeah, we've got 15 minutes back, so we better get this submitted. Let's see, resources, here we are, submissions.
You go back to your quick submission, so you go right back to that. That brings you back to your dashboard, right?
Yeah. And so I'm going to submit. So we've had the meeting, everybody thinks it's fantastic, and I think I've done a great job, and I'm going to submit it. Oh dear. I have some problems.
So you will notice that for some of these, it's because we didn't have anything in there. Remember I told you that if you've decided not to work on it, your current performance might be there, but you need to put into the comment section why you've chosen not to work on that particular indicator. So some of those are as simple as that. But the one that we just did, number 8, so Mark, you can probably see it a little bit better than I can. It tells us you must include at least one change idea with a planned improvement initiative, method, process measure, and goal for change ideas. So remember, we put in everything except for the measure. And so it highlighted to us that we're missing something there. We didn't put in target justification. Remember I said to leave that to Mark. It won't submit unless you put in your target justification. And it certainly tells you that your process measure wasn't completed. So if you go back, Mark, and just put some data in there, you'll see that when you try to submit it, then it does disappear.
Okay, and just if you do have a bit of a list, you can print it so that you can move it. You can save it, but you can see you may not want to leave that right until the very end. And if you do get a clean sheet, it will take you to the next page that will ask you to fill in your senior leadership team and that they've agreed, and then it will go right through. All right, so back to the work plan, edit. So we had problems in number 8. Scrolling down, see the number 8 on the far side. So there was problems in here. I didn't have
target justification.
Improve. Blah blah blah.
Yeah. So whatever your target justification would be, you'd put it in there. And then the other sections. Remember that for number 8, we didn't have the measure in there.
Okay, I shouldn't be in this one.
Oh, you're going to go into one. That's right, that one.
So either the number or the percent of blah, 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 by when, blah, blah, blah. Okay, save and close. Okay. There was something about number 2. I'm just going to try to figure out. Can people see what's wrong with number 2?
For number 2, we actually added the current performance, did we?
Yeah.
Yeah, it was suppressed, yeah.
So we'll take that out and save and close it. Okay, so let's go back and see if we can submit. Well, we're down. We've got rid of the 2 errors and the 8, but we still have some other things to do.
And I think those were ones that, again, we either didn't put anything into in the practice, or we purposely left out for training in other sessions.
Mm-hmm. So again, just encouraging you to get on to that sooner than just right at the end, because it can be kind of confusing when you get to that page, and you don't want to panic. Just, you know, it's like a bingo sheet. Just find the indicator, go along to where the section is that it's asking you to complete. Alrighty, I think we are doing well, Trish. We're 10 to 5, and the questions, it looks like, have been answered. I don't think there's been a couple of people with some login information issues, and so they've been contacted by our assistant, so that's wonderful. Just to let you know, to reiterate, this work plan indicators completed, while it says 5 out of 10, there are only 7 that you have to comment on or complete. There's an extra 3 that are additional, that are optional, but It just is a quick way to know if you've actually started a section. It may not be telling you that it's complete or that you've done a great job in that section. So anyways, I guess we'll be putting this up onto the Navigator site, and you people can be looking. It may be this one, it may be another webinar.
But certainly it's very similar information.
Mm-hmm.
I don't see any new questions, Marg, so let's give people an extra few minutes back. Not very much time, but 10 minutes better than no time.
Yes.
We thank you all very much for your attention and for joining us today and for your questions and your comments. And we certainly look forward to seeing your quality improvement plan. So again, if there are any questions, concerns, or you need things clarified, QIP at hqontario.ca, and we'll be able to get back to you. Thank you all. Have a great evening. Bye-bye.
Bye.